Hi everyone, welcome again to the Borderline Personality Disorder Family and Consumer Education Webinar Series. My name is Chris Palmer. I'm a psychiatrist here at McLean Hospital and Harvard Medical School, and it's my pleasure to be able to moderate this series. Before we get started, a few logistical announcements. One is that all of your identities, emails, phone numbers have been hidden from other participants, but we do want this to be as interactive as possible. And so the way that you'll communicate with us is through the Q&A box in the lower right-hand corner of your screen. And so we'll have a presentation, and then we will take questions and have discussion after that. If you've come to this webinar with specific questions in mind, feel free to put them in the Q&A box now, and we will queue them up and try to get through as many of them as we can. In the lower left-hand corner of your screen, you'll see links to several websites. The first one is our homepage, where all of our webinars are archived and viewed, and you can also register for upcoming webinars. The next link is actually to register for our February 15th webinar. And then the next three resources are related to borderline personality disorder. They include a lot of educational information. Some of the websites can also include some referral information if you're looking for a treater who has expertise in borderline personality disorder near you. Some of those websites can be helpful. And finally, I want to just say that this webinar series is made possible through a philanthropic gift from a family affected by borderline personality disorder. And we would love to be able to continue the series, but would need additional funding in order to do so. If you're in a position to be able to support these webinars, we've got a link that you can click on to support the webinars, and any gift, large or small, would be greatly appreciated. And now it's my pleasure to introduce today's webinar. We're joined by Katy Tarella, who is a social worker in our Gunderson Outpatient Treatment Program, which specializes in the treatment of adults with borderline personality disorder. And she's going to be speaking with us on family therapy, but you see the title of her talk is You Want Me to Do What? Kind of leading into how emotionally charged family therapy can be. And so I'm going to turn the webinar now over to Katy. Thank you.
All right, thank you so much. Good morning, everybody. I'm really, really happy to be here. I'm also very nervous, so I think that that is something to put out there. And I also think that it's pretty relatable because being in family therapy can be very nerve-wracking, and I would like to model that it's okay to say that. So what I want to talk about today, Chris already mentioned the title, but You Want Me to Do What? Was really the thought that kept going through my mind when I thought about doing this webinar. I have had the opportunity and the charge of telling many family members that I would like them to try something, and that, trust me, it's for the best, and that it really requires a lot of trust in the process and can be very, very difficult. So I really want to open this up. I would love to hear lots of questions at the end, so I'm going to move through my material. But this is difficult, and I think it's really worthy of talking about and discussing and getting help when needed. Okay, so that's where we're going to start. Okay, so I want to just go over a little bit actually about myself, then a very brief outline of what I'm going to talk about today, and what you can expect to talk about today. So my name is Katy Tarella. I work at the Gunderson Residence, which is an adult residential program for women with borderline personality disorder. I have worked there in many capacities, which is actually quite interesting for myself. I started working there after college as a community residence counselor and really learned a ton hands-on in the thick of it about borderline personality disorder and about treatment and about what that looks like. Really got interested in the family aspect of the treatment, seeing families come to visit, seeing interactions, seeing the difficulties, seeing the triumphs, seeing all of the ups and downs that come along with the family aspect of treatment, and really decided I wanted to focus on that when I went back to get my master's in social work. So that being said, today I do want to mention that this presentation is really geared towards family members who have a family member of their own, a loved one who is in treatment for borderline personality disorder. That doesn't mean that you can't make use of this presentation if your family member or loved one is not in treatment. It's just where I'm coming from in the approach that I'm talking about. So that's just something to keep in mind. I'm going to talk a little bit about what to expect in family treatment, what it really is, very briefly, very broadly. I'm going to talk about some resources that I suggest you utilize. These are not the only resources by any means, just a couple that are a good place to start and that I've personally found very helpful. Then I'd also like to turn my attention to some helpful skills to focus on when you are involved in family therapy for yourself. I would like to mention with that I'm coming from mainly a dialectical behavior therapy foundation and perspective when I'm talking about family therapy. That's not the only treatment modality that works by any means. It's not the only modality that I use. I just find it a very helpful place to start. So within dialectical behavior therapy, DBT, you may know that there are tons and tons of skills. I don't think that I could ever even know them all, having done this for years. So what I think is most helpful is to think about just a couple, actually, of the skills and really hone in on them and really practice them. And that will kind of give you something to put in your back pocket and a way to frame how you want to come at being a supportive family member. And that brings me to my last bullet here, which is the whole point of this is how to be a supportive family member within the context of family therapy and treatment, and how to get your own support. And I cannot emphasize that enough. I really feel that you're setting yourself up for success in family therapy and the well-being of your loved one who's getting treatment for BPD if you can acknowledge the areas in which you need your own support. None of this is easy, and that will just be a given. I'll say that over and over again, but none of this is easy. So we'll talk more about that towards the end. All right, so what is family therapy? That's a huge question. I am not going to do it justice or really go into it too much, but just to touch on some really main kind of ideas and topics here. So something that I think gets missed in family therapy, or something that is not necessarily understood, is that you are really trying to focus on both the individual dysfunction, that's the word I'm going to use, and the relationship dysfunction at the same time when you're in family treatment. So what do I mean by that? I think that it means you are both appreciating that everyone brings something to the table, everyone, that the ways in which you relate to each family member contribute to how the family functions as a whole, and that you're kind of not wanting to focus too much on one or the other. You don't want to focus too much on the individual problems. So it's very easy to fall into a habit of focusing on the family member who has diagnosis of BPD. Of course, that might be the presenting problem, and that might be the reason you're all there. That's true. But undoubtedly, it's not the only problem. And so finding a balance between our own problems that we bring to the table, our own individual struggles, and the ways in which our relationships and the way that we work together in a family come together and both contribute to fuel problems, but can also be the ways in which we disentangle those problems and come back to the table with a way to change them. This can be really discomforting. I will just say that bluntly. It is not comfortable to talk about problems within a family. Give me just a moment. I don't think anyone likes to do that. It's not natural. And so when you come to the table and you're sitting together as a family, I think you can expect some anxiety, anger, frustration, all of those lovely negative feelings that no one wants to feel. And really just put it out there. The more that we can acknowledge them, the more that we can work on them, and that it will be uncomfortable at times, but that discomfort and that anxiety is really for a reason. It's part of the process. The longer you avoid it, either the more intense it's going to get, or the more explosive perhaps it could get, or the more shut down. So really kind of put that out there. It's going to be uncomfortable. Here we go. Next thing I want to say, and I'm going to say this over and over again throughout this presentation, is that progress is not linear. And I think that can be said in general for treatment of any long-term condition. I think borderline personality disorder is under that category. It takes some time to treat. And that it's really reasonable to get frustrated along the way when things don't feel like they're moving forward, or there is some sort of crisis that comes along the way just when you feel like you've been making progress. And I do want to normalize that. That's really okay, and that is to be expected. So what I like to think of there is the idea of taking 2 steps forward and 1 step back. Not 1 step forward, 2 steps back. I think it's pretty reasonable to expect making progress and then sliding back a little bit, but on the whole, on the average, if you're wholeheartedly engaged in the process, you're generally moving forward. Then finally, I've said this already, and I'll say it in many different iterations, everyone plays a part in the strengths and the weaknesses of a family. We can move to the next slide. Okay, so you can get a sense for my humor here. I tried to pick as many kind of light and funny pictures, memes, and whatnot to both show a little bit of my personality, but also to emphasize that this really requires a sense of humor. All of this. Treatment in general, but family therapy, I think, goes a long way when you can really inject some humor and not take it so seriously. So, that being said, what are you signing up for? I want to outline in a general way the idea that a family is a system in and of itself. So, as a social worker, that's really where I'm coming from most of the time, is that in treatment we can look at things as various parts of a system, and a family really falls under that category. Family is a group, a family is a unit, and a family is kind of like an organism in and of itself. It has its own life, separate from all of the individuals. When you take that organism, that being, and that unit, and put it in a room together, you are treating it as a unit. We're looking at ways that we can strengthen the unit. And I think that that can help alleviate some of the pressure and some of the intensity at times. If you can really take a step back, a long view of the picture here, and think, okay, this family functions, it's a thing in and of itself, and we're here to treat it. Okay, so next thing I really want to highlight too is that every interaction is a transaction. I'm going to say it again. Every interaction within a family is a transaction. So that means basically it's a two-way street. For every thing that you say, for every feeling that you bring, for every piece of body language, nonverbal, whatever it is that you are coming to the table with, there's going to be a reaction to that. So I think that that can help diffuse some really difficult situations when we kind of tear it down, tease it apart, and think, what did I do in this interaction, and how did the other person respond to it? Then what did they do, and how did I respond to it? That way we're really decreasing the idea of blame, trying to take a non-judgmental view, and look at the fact that we are all contributing to a dynamic, and that dynamic may be problematic, and it probably is, because that's why we come to family therapy. So that being said, I want you to get ready to examine your own contribution to problematic dynamics. That's extremely important. When you can look at your own contribution, then you can start to become part of the change and the solution versus continuing problematic patterns and dynamics and fueling what is not working. It's not going to happen right away, and I know that it's really hard sometimes when you feel so strongly that you have tried your hardest to be a supportive family member, to be the best parent that you can be, to be a good sibling, whatever it might look like for you. But I guarantee you, no matter what your, even if you're coming from the best place, if you have the best intentions, which I actually believe that we all are, there's still something that you contribute to the problem. Quicker that you can realize that and acknowledge it, the better. But that's okay if it's hard. That's a family therapist's job to cultivate thinking about that. But I really do believe it would behoove all of you that are listening to think about, what do I bring to the table here? So all of that being said, I think it really brings us to the idea that the more you can embrace the idea of family therapy as an opportunity to strengthen, to treat, to nourish the family as that system of support, that's ideally how we want a family to function, that you can really kind of help move things forward in the right direction. So it's really important, that last little bullet I put down there, that everyone, not just the individual who's diagnosed with BPD in the family, can benefit from family therapy. It's really a equal opportunity disorder. So actually, before I move on to family guidelines, this next slide, I do want to say something that I forgot. I should have said at the beginning of this webinar. Something that I really believe wholeheartedly and try to use as my mantra when doing family therapy is that borderline personality disorder affects the whole family. I didn't make this up. I got it from many different sources and mentors and teachers and experiences, but I really wholeheartedly believe it and feel like it can't be said enough. BPD affects the whole family. It is difficult. It is stressful. And it can really take a toll on your own mental health and your own well-being, let alone for the person who is struggling with BPD themselves. And so take that into consideration. This is really a whole system problem, and that's why I think family therapy is so very effective for the treatment of BPD, to be part of it. So as I said in the beginning of this webinar, I do have some suggestions for resources and places that you can start to look for some really good feedback, some good advice, and some good guidelines. The first support that I really recommend you read, if you have not already, or if you have, read it again and again and again, are the family guidelines. Sorry, I'm behind here. The family guidelines are a set of ideal sort of suggestions for ways to approach problems within a family when there is a loved one diagnosed with borderline personality disorder. They were written by John Gunderson and Cynthia Berkowitz, and you can find them on the NEA BPD website. So I did put a link here, but you can easily Google family guidelines for borderline personality disorder, and it'll come right up. You can download them for free. This, I do think, helps to really, in plain language, put on the table some of the more difficult situations that you're going to come across when you are really addressing the problems that come along with BPD. The family guidelines are broken up into a few categories, and then there are subcategories within them, and very helpful examples of how this might actually look within a family. So really good place to start, like I said. I do want to outline the categories because I think they ring true with what I am presenting today as ways to kind of approach family therapy. So first one is to go slowly. This is really hard, especially if you've been struggling as a family for a long time with the problems that come up when a family member is symptomatic with BPD. So that can mean crises, lots of dysregulated emotion, difficulty moving forward, difficulty transitioning, going to college, first jobs. These sorts of things are really common areas of frustration and difficulty in families that I see. Going slowly is really hard because I do find that when you finally get the momentum going and you're in family therapy, you kind of just want to, a lot of people have the urge to bite the bullet and just go in hard. Let's put it all on the table. Let's talk about it all. Let's talk about that time when I was 5 years old and I never told you this, and I've been holding on to this resentment for 10 years. And yes, we do want to get to all of that. But don't be surprised if your family therapist is reluctant to dive into some of the more loaded issues. And don't be surprised if it feels like what you're doing in the beginning of family therapy is kind of ridiculous. So again, title of the slide, you want me to do what? Here we are with my daughter who is intermittently suicidal, having a hard time managing at college, failing, difficulty with friendships, drinking. I mean, this is all, I'm sure, things that you've either experienced or can imagine very easily if you're in this situation. Even if we're in a big crisis, even if things are looking really dire, it's still important to slow down and clearly identify what the problem is, even if it seems so unbelievably obvious. Because yes, there's usually a presenting problem that's glaring and obvious. There is also sublayers and pieces to that puzzle that are really important to understand. So you're going to need to tolerate going slowly. It's also helpful for the treatment longevity of borderline personality disorder in general to move slowly through the process. There's such a tendency, once you gain some traction, to want to take it all on at once, and that usually is setting someone up for a crash or disappointment. It's just like anything when you're trying to change a habit. How many of us have tried to start a new habit, like exercising regularly, eating more healthy, not looking at our phones or technology as much? If you try to go all in, crash diet, put your phone away all day, you're going to have that rebound sort of, I can't actually manage this, it's too much, I'm going to go right back to it. So, relatable. Take it slow. Another category that is really important to focus on that's talked about in the family guidelines is looking at the family environment. Something that I recommend to every family I work with, and that might be something common you'll see in your own experiences, is to set up consistent communication between family members. So, for example, maybe before you have started family therapy, you as a mom have been talking to your daughter every single day, maybe more than once a day, texting, calls, emails, nonstop. Maybe that's because your daughter is in so much distress and you feel like you really can't stop that level of communication, that it would be really harmful. But usually what's helpful when we finally get a handle on the problem and you're in treatment is to slow that down and make it more consistent. That goes for family rituals in general. So spending time together as a family, communication, family get-togethers, all of that is really important to stabilize and make as predictable as possible. So for example, you might be asked to schedule times to talk as a family, maybe once a week, maybe twice a week. That can feel really awkward. I get this complaint all the time. What am I supposed to talk about? You want me to talk about light topics? You want me to have a predictable and set up conversation when I am, really struggling? Yes, I do, and your family therapist will as well. So thinking about this as something that's being asked of you that is really helpful for the long term and trusting the process, this is one of those pieces. So family environment, making it as predictable and stable as possible is very helpful. The next category that we look at here is managing crises, and this is a really, really tough one. This is a huge topic and place of importance in family therapy when treating BPD. So the importance here, and I can't get into it, this could be a webinar in and of itself, so I'm only going to scratch the surface. But the importance here when we're talking about how to manage crises is striking a balance between paying attention but also staying calm. And this is really kind of counterintuitive. And I think something that you can really lean on your family therapist for if you're in this process. So if your loved one who's getting treatment for BPD is suddenly really distressed, highly distressed, feeling hopeless, maybe suicidal, when you haven't seen those, heard that sort of talk for a while or seen your family member in such distress can be really disconcerting. Part of the therapeutic process, though, of family therapy is reorienting yourself as a family to how to manage crises. It's no one's fault, and there is actually no help in blaming, but many times leading up to what has brought you to family therapy obviously has not worked, does not help, is understandable. So what I mean by that is responding in a very sort of reactive way to distress. So something that's helpful to talk about in family therapy, given this, is really being very clear with your family member who has BPD, what they mean when they are feeling a level of distress, and if they can learn to communicate clearly what they are feeling, and if that is associated with any urges to hurt themselves or any, suicidal thoughts or behaviors. We can't take this out of the picture. This is a huge part of the problem in BPD. Something that really helps is to get clear about it, and as a family member, to practice exposing yourself to the reality that your loved one with BPD may at times and for a long time think about suicide or intermittently feel suicidal. A big difference, and something to really note, is when your family member can recognize suicidal thoughts, urges to self-harm, and not act on them. So what I see very often is that as we kind of get moving in family therapy and some of the symptoms of BPD are starting to diminish, that you feel such a sense of relief that you're not in that place anymore, for example, where your family member is talking about hurting themselves. But really try to remember, it's going to come back up, and that's part of the disorder. And that's okay, as long as your family member can clearly communicate with you what they're feeling, thinking, and if they are at risk to hurt themselves. In this process, lean on your family therapist Ask any questions you have. If you're worried about your family member's safety, ask. Ask your family member, ask your family therapist. Don't be shy. You may be met with a negative reaction. That's very common, but don't let it stop you from asking. You're better to have the information than to worry about it. And I think that can help to really diminish the anxiety that is so often associated with self-harm and suicidal behavior or thinking in BPD. So that is a longer-term process, but something that is to focus on how to stay calm in the middle of a crisis. Easier said than done, I know. Couple more categories here I just want to touch on. Addressing problems within a family, how to do that collaboratively and how to be consistent. What might be more common in a family with a family member diagnosed with BPD is to have sort of flip-flopping responses to difficult situations, either to be very sort of controlling and really involved for good reason because things may be out of control, or to want to just take a step back and let your family member try to work out the problems on their own. Maybe that's what they're desperately asking for. Generally, what's more helpful is to find some sort of balance. Again, theme here is finding a balance. Learning how to collaborate on problem solving and how to be consistent when facing problems is a major focus here. Then lastly, something I'm going to come back to, but I'll just touch on here, which is in the family guidelines, is limit setting. This is a huge topic and very, very important piece of family therapy. I would argue an important piece of life in general, how to set limits in relationships. Being direct about your limits, being clear about your limits is perhaps the most helpful thing that you can do when engaging in family therapy. Be honest with yourself about your own tolerance. Be honest with yourself about your own limits. It's really the idea of putting your oxygen mask on first, and I know that that is a fairly cliche saying, but it really stands to reason here that if you, as a family member, can identify when you have a limit, emotionally, physically, financially, the better off you are to help your loved one with BPD. Again, another piece that sounds counterintuitive. I think that it comes across sometimes as threatening. Believe there's a big difference between threats and limits. So again, limits, what we want to focus on here are your limits, your tolerance. Be clear about it and direct. So those are family guidelines. Read them, bring them to family therapy. They are very, very helpful. Okay, so on our next slide here, we have another resource that I find extremely helpful. I don't think it's showing up yet. There it is. Okay. Family Connections. Family Connections is a 12-week program that is for family members who have a loved one with BPD. It is peer-run, so it's run by other family members who have gone to training and who have gone through the program themselves and then gone through a trainer's course and come back, with a little bit more, knowledge of how to direct and how to support other members of the group. I have both gone through a Family Connections program as a semi-co-leader. Even though I was a clinician, I was able and allowed to kind of sit in the program and be a part of it. I was again and again so very impressed with the tone and the openness that this program set, and that people came week to week so ready to support each other in a way that was so unique and special and important. So I cannot recommend this program enough for any family member listening. And if you have other family members or you know people who are in the same boat as you, please tell them about it as well. So Family Connections is free, and you can sign up through NEA BPD. Again, great resource. I put a link here, but Google it, find it online. There is likely a waiting list, but it's for good reason. It's a very, very effective and popular program. So generally, just to very quickly highlight, so I do want to move forward, the way that Family Connections works is to provide psychoeducation, first and foremost, about borderline personality disorder, to provide you with actual skills training. It's very akin to you being in a dialectical behavior therapy group like your loved one may be. So you are actually learning the skills hands-on and talking about them, learning them, being able to practice them and use them. And then the third piece of this that comes together is the support that inherently comes with this type of group. So check it out. Okay. Next piece of advice that I would like to offer and really focus on is psychoeducation. So as a backdrop here, as mentioned before, I work at the Gunderson Residence, and I'm a family therapist there, and I also run a group with our patients. And we talk about family therapy, we talk about strategies, we role play. It's a very sort of dynamic group. But one thing that I sort of selfishly did was ask recently all of my group members if they could tell me one thing that they would find most helpful for their family members to know about family therapy. Because when you're the person diagnosed with BPD, you're in your own treatment. That's kind of the basis we're going off here. You're getting a lot of support for yourself. The reality that I see is that family members are not getting the same support. You may be coming to weekly or biweekly family therapy, whatever it looks like, and you are, learning in that setting, but that's often really not sufficient or enough to help you really understand and make the most use of what's sort of going on in this process. So I asked my group members, what would you ask, what would you say, hey mom, hey dad, hey like sister, brother, whoever it might be, this is something that you can do to help. Well, that resoundingly was psychoeducation. So learning about borderline personality disorder, about treatment, and about mental health in general, I think is really helpful. Just read anything you can. Get out there. NAMI, the National Alliance on Mental Illness, is another great resource. The NEA BPD, as I've said over and over again, is chock full. The website is absolutely full of helpful resources. Asking your family therapist about recommendations, things to read, things to watch, articles, whatever it might be. Get in it. Get interested and get involved. Learn what you can. It will go such a long way. And for me personally, I did put this in here because I feel this is so relatable. When I'm facing something uncertain in my professional life, I'm very sort of troubled or stuck or confused about how to approach a situation. Going back to the books basically is my #1 intervention. I find it unbelievably helpful to take a step back and learn and get yourself thinking about the problem and then come back to the table. When you're so involved emotionally and personally in this process, it can feel really overwhelming and you can lose perspective. So learning and applying yourself to sort of the philosophies and principles of what's behind the treatment is actually very, very helpful. And then lastly, on this note, I do think that a byproduct of really, really getting invested in learning about borderline personality disorder and treatment is that you are sending a very strong message to your loved one diagnosed with BPD that you care, that you're in it, that you are trying to learn too, and that you are not all-knowing, you do not have the answers, but you're willing to try and learn too. I think this is a very alliance-building and supportive way to approach this very difficult task of family therapy. Okay. So as I said at the beginning, I'd like to focus on just a couple of skills that you can hone in on, really sink your teeth into, and that I find most helpful and that I come back to again and again in family therapy. That first skill, and maybe the most important skill, is validation. Okay, validation, kind of controversial at times, I think. Has a place, is not always warranted, but is extremely important. If you learn any one skill along the way, I think you should make it validation. It will not only help in your relationship with your family member, I think it just helps in general. So it is a skill basically of being able to acknowledge another person's perspective, to acknowledge their emotional experience of a situation, and to kind of pay tribute to it. This is not akin and not equal to agreeing, and this is probably what trips people up the most. If your loved one with BPD is expressing an emotion that makes zero sense to you, and this will happen. People with BPD have a difficult time with emotions that are very intense and come on very quickly and last for a long time. It makes perfect sense that their emotions sometimes will be not equivalent to what the reality of a situation may be or how you would perceive a situation to be. Put that aside, that actually doesn't really matter. What matters much more is your ability to acknowledge and recognize your family member's experience. This takes tons of practice. I think that until you can really do it out loud, say it, mess up, fumble, that you really won't feel any sort of natural inclination to be validating. So I do think this is one of the skills that is something you just have to go in and dive in and do. The good news about it, I think, is that when you can be curious and open and just trying it out, if you get it wrong, that's actually part of the process. So if you're able to say, okay, what I hear you saying is that you're extremely disappointed that you didn't get the job, XYZ, whatever the situation might be, and that you're angry at yourself for not having responded appropriately to one of the questions, so just off the top of my head. As a parent, let's say in that example, maybe you think your son or daughter did a very good job. Maybe you think that they nailed it and you're really proud of them and you can't believe how hard they're being on themselves. Of course, you're going to want to say, no, you did a great job. Why would you think that? You're being too hard on yourself. Validation is kind of the opposite. You want to be in it and you want to recognize, wow, it sounds like that was really, really hard for you to put yourself out there, and it sounds like you are very disappointed in the way that you responded. That sucks. Okay. It's going to sound like hollow and empty at times, but trust me, the more you practice and the more you practice with your family member, the more it's going to come naturally and actually be part of the conversation and feel really important. So one last thing I'll say about that, and there are books, there are articles, there are resources on validation that you can go to, but one part of this is also self-validation. So as much as it's good to practice validating your family member's experience in family therapy, it's also really important to acknowledge your own experience, even if it doesn't sort of match what you would want or how you would want to be acting in a situation. The more that we can be okay with how we feel in the process, because it's complicated, I think the better off. Okay, another skill that I think is worthwhile of diving into is being able to set limits. So this is a huge topic. I'm not going to be able to do it justice, but it really is probably, in my opinion, the most important thing that you can do for your family member if you are engaging in family therapy or if you are in any way interested in trying to support your family member's progress. This skill, I think, often feels at times punitive or threatening or overly negative. But the fact of the matter is that when your family member, loved one, whoever it might be, diagnosed with BPD is struggling with intense emotions and perhaps as a result some negative or some not so great decision making, there are often consequences that are undesirable. So what you can do along the way is stay steady and be clear about limits. So one of the ways this comes up over and over again that I see in family therapy is around money. It's a really hard topic. And somewhere I think that people give and take perhaps for very good reason, but don't set a very clear expectation or limit. So being able to say, for example, that this is the budget that I'm going to help provide for you, this is the expectation of what you can spend that money on, and here is, what I will do to help you if you are struggling along the way, for example. You're not saying, here's this money I'm going to give you, and if you spend it the wrong way, then I'm going to stop providing for you financially. Maybe that's actually the point you get to at a certain stage, and being able to say when you're clear and there's an ultimatum on something is important. There's a time for that. But when you're trying to help a family member change a behavior that maybe they really have a skills deficit in, you need to be clear and you need to set limits. This, I think, really creates a lot of short-term discomfort at times, but really it's in the spirit of long-term stability. And I do think that when a person who is diagnosed with BPD is in the thick of their treatment, it can be so intense for so many reasons that having edges and clear boundaries is so helpful. I don't mean that it's going to feel great and that it's going to be reassuring and that it's going to look like it helps right away, but I do wholeheartedly believe that providing those boundaries and those limits is something that you are really doing to help your loved one, your family member, and takes quite a bit of practice. I understand. Kind of wrapping up here, I really do believe that these are skills you need to practice. They are not second nature. They, again, may be against what you have believed for a long time. They might feel counterintuitive. They might feel wrong. If they feel really wrong, I'm not saying just go along with it for the sake of going along with it. You know, if you really don't think that something is the right thing to do, speak up. But within reason, I do believe that practicing what is suggested by your family therapist, what is recommended, and giving it a real wholehearted try is in your best interest, and seeing what happens along the way. And so like my little picture here, you're really building your psychological muscles. You're building the resiliency of your psychological muscles, your emotions, and your reactions. And you are really helping your family member along the way. Finally, don't neglect yourself. I think it's really, really understandable and easy and slippery slope to get really involved and throw yourself into family therapy in a way that is so admirable. I see this a lot. But family therapy, like I said in the beginning of this presentation, is really about individual and relationship problems. And this may really unearth some problems that you have within yourself. Looking at the negativity and the difficulty with emotions in a family member with BPD may also bring out some of those same problems within yourself, and maybe you have really put away for good reason. If you are struggling with your own emotions, your own feelings, your own thoughts, and your own experience in this process, talk to your family therapist about it. It doesn't have to be in front of your family member. But get a line of communication open about that, and consider getting help for yourself if you need it. I can't tell you how many family members I've worked with who along the way have said, you know what, I think I really need my own therapy. And it has gone such a long way in helping that person both understand themselves better, but also just be there for their family member, because you need your own support too. And there's absolutely nothing wrong with that. So pay attention to yourself, take care of yourself, ask for help. All right, that is about all I have to say for now. I'd love to hear questions. We don't have too much time, but I will open it up here.
Great. Great. Katy, thank you very much for a great webinar. We do have questions already in queue. So one person asked, and I think this is a great question. So if you have a child, in this particular case a teenager, who's reluctant or unwilling to participate in family therapy, any advice for how to encourage or increase commitment in that loved one to maybe consider it or actually participate?
Okay, that's a really great question. I think for this example, being a teenager has its own implications, but can be for any family member, any age. But I would say that if you can model for your child the idea of getting involved in the therapy yourself, I think that can go a really long way. There are pros and cons to that. So say your child really says, I'm not going to do the family therapy, I refuse, and maybe you and your spouse decide you're still going to meet with the family therapist regardless. That might be a way to say, hey, we're still involved and we're still going to do this. We hope that you will join us. You know, like I said, pros and cons there, because it might feel like you're excluding your child, or they may get worried about what you're talking about not in their presence. That could also kind of increase the buy-in to get involved. I think also setting some clear kind of goals for the reason why you're going to family therapy together might be helpful. So sometimes, you know, can seem like really scary, especially as a teenager, I would think, to get involved in family therapy. It's not something you probably talk about with your friends at the time. It may be something you think you're the only one doing. And so I think, you know, as a family, talking about why are you doing this, and kind of getting, you know, some reasonable goals. Like, we want to be able to communicate really clearly together as a family. Identifying as parents in that situation what you think you can use help with, I think goes such a long way. So if you can really realistically say, you know, don't sort of make it up or, you know, kind of do it just for the sake of doing it, but if you really think you could benefit from it, saying why. Like, listen, I know you don't want to do this. I know it's scary. I'm actually really nervous myself. But as your mom, I really think that I need help learning how to communicate with you, because sometimes I feel like I'm not on the same page as you, and I just really want to learn how to do that better. And it would really help if you were there with me to provide, you know, that knowledge for me. You know, so you're kind of saying, I need help with this, and I need you there to help me too. I think that might be one way to kind of increase buy-in and to really put yourself in the ring too.
And let me just actually follow up on that, because as I'm thinking about it, at least in some of my experience, and I'm interested in your perspective, but in some of my experience, I think sometimes the person who is being invited to go to family therapy feels like you're just looking for an opportunity to gang up on me. And you want me to get a job, and you want me to be responsible, and you want me to not, you know, be suicidal anymore. And I get that. And I wish I could, but it's not that easy. But you just want me to go into a room, and then all three of you are going to gang up on me, and none of you get it, and none of you are going to understand how difficult it is for me, so I'm not going.
Mm-hmm.
And if that is a mindset of the person, I completely agree. I think if the parent reframes it in the way that you just suggested, like, I need help. I need help in how to do this.
Exactly.
Or if you reset the problem as we as a family aren't getting along. There's an awful lot of conflict going on in our family, And it's not just about you. It's about us. It's about all of us. I think if you kind of decentralize the problem and take some ownership of I need help, or I want to learn how to be a better support for you, or then it might be possible to get more buy-in.
Totally agree.
The next question is, my daughter's invited me to a family therapy session with her own therapist. I feel a little bit awkward about this, but glad she's at least considering it and setting it up. And is this okay? I think it's a great question because I think that comes up a lot. And then there are often questions related to that of, is the therapist going to be on her side? Is the therapist meeting with us just to berate us about what awful parents we've been? Like what's going to happen?
Oh my goodness, great question. Yes, we're totally setting you up. That's exactly what we're doing. It's all I've ever wanted. That's why I went to school. No, I'm hemming it up because it's so understandable to feel that way. So first, let me back up. I think that if your daughter is inviting you, that's awesome. Take her up on it. I think that should be reinforced so heavily if she's really even opening up the idea that you could be involved. And I would look at it actually a little bit less as a family therapy session and more of you joining her therapy session. Maybe you need to learn a little bit more. Maybe you're really curious about what's going on and you'd love to know, what she's working on and get to know her therapist. I do think it's perfectly acceptable. It's okay. But I also think that you can acknowledge it can put people in a difficult position. It can make perhaps your daughter feel uncomfortable, you feel uncomfortable. But looking at it as an opportunity to just get involved might be a way to kind of back up and kind of slow it down and lessen the intensity. And I really can guarantee that it's not going to be, at least if this is a well-intentioned treatment, a gang-up session. But one caveat I will make to that is that your mindset as a parent going into this really matters, because if you are feeling like you're going to get ganged up on off the bat, I imagine it might be a little bit of a self-fulfilling prophecy. So it might be a great idea to talk to your daughter beforehand about what she wants to talk about and if there's anything that you should know. If there's anything that you should think about, if there's something that she really wants to talk to you about. Because again, that open mind about what you contribute to the problem goes a long way. Great.
We probably have time for maybe one more question. And so this question is about, this is a common question that we get. So my son, daughter, family member refuses to get treatment. Mm-hmm. They won't acknowledge they have a problem. They won't acknowledge they have borderline personality disorder. And in this particular case, this family member says, it's the family that's the problem, it's not me. Mm-hmm. Given that struggle, this person asks, would it be advisable, given her son's statement that it's the family that's the problem, it's not me, would it be advisable to maybe take him up on that and say, well, if it's the family that's the problem, maybe we as a family should think about going to family therapy, and might that be an opportunity for a trained therapist to do somewhat of an assessment and maybe hopefully persuade him to get his own individual treatment?
Wow, that is such a good question. It's multi-layered. First things first, I do believe it's a great opportunity to acknowledge if the family is really struggling. Maybe the son in this scenario, I think we're saying, is the one who the parent is really worried about and needs help, and probably does. But just because the son is the symptomatic person in the situation doesn't mean that you can't all benefit from talking to a therapist together. That could really increase buy-in and motivation if you're saying we all have to get some help here. I would be a little bit wary of thinking about this as an opportunity for a therapist to do an assessment, because if you're going for family therapy, that's actually the job of the therapist, not to also do an individual assessment on your son or anyone's child in this situation. But I do think it's appropriate in that situation to kind of give the therapist a heads up about what you're worried about, and perhaps that therapist can then keep in mind the parents are really worried about the son. I can make some recommendations on things that I see as a neutral third party. I can look at the situation and say, here's what I see happening, here's what I hear. That might go a long way too. But I think coming at it from a place of this is something we're going to do together as a family, just kind of going with that expectation might help you set you up for more success than hoping that this will then turn into an individual therapy. That would be ideal and wonderful and great, but when you're really attached to that as the outcome, then it may take away from your involvement and actually putting yourself in the picture.
Great. So with that, unfortunately, we've got more questions in the queue, but we're going to have to end for today. Our time is out. I want to remind people that our next webinar is February 15th. We'll be hearing from Dr. Karen Jacobs on integrating biofeedback as a tool in treatment for borderline personality disorder, helping increase self-awareness and self-regulation. So you can click on that link if you'd like to join that webinar. And with that, it's really my pleasure, and I want to give a big round and thank you to Katy, Tarella, for a wonderful webinar.